Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can be profitable and successful for years to come. This week on the Edge Podcast, I welcome Callie Ward of Dash Dental. Callie is a seasoned professional with over 35 years experience in the dental industry, with a background that encompasses dental front office and management experience of both single and multi-location practices. Callie has gained invaluable insights into the key elements that foster thriving practices. And as a consultant, Callie's mission focuses on helping dental professionals align core values with effective communication, leading to gainful production and successful dental practices. Callie, welcome to the podcast.
Thank you so much. I'm excited to be here.
Well, we are excited to have you, and I really like the topic you sent over to me for discussion today, because I think sometimes things do get lost in when we're talking about, the doctors are paid by production or how's our collection. And I think it's important to show the contrast and the similarities on what is more important to a practice success, collection or production. So I'm going to start it off there with you. And obviously the successful practice needs both. But if you had to kind of argue a position, where would you start with that question?
Thank you. It's a great question. I think the reality is there's different types of practices, right? So we have some practices that are independently owned and the owner is the provider. So production and collections are equally as important, but there are also other practices where maybe it is a DSO where a corporation owns the practice and we have providers working in the practice. So there's a little bit of difference between the skin in the game and the drive for the production to reach the collections. And I just bottom line, I really don't care what you produce. It's what are you collecting? And are we collecting enough to pay our bills? Are we collecting enough to get the practice to profitability? Are we able to pay our team a great salary so that we do not go through team repeatedly? There's so many different aspects of the practice, but it's fantastic when a provider says that they can produce these massive amounts, but if we don't have the systems in place, if we don't have the team in place to collect that, the impact isn't there. Like it just is this number that feels really good that we produced, but if we can't collect it, it doesn't do anything for the business.
Well, it's funny you said that, because obviously production represents the services rendered and, kind of creates the value for the practice. But as you said, first of all, without adequate production, there wouldn't be anything to collect, but you still have to have an efficient collection process. Otherwise, production is secondary to all that. And I don't know if you've seen this, a lot of practices, I think especially in the dental field, my nephew's wife, she's a dentist, and she says, valuation of practices, when I was trying to integrate, she said they value things on production, but I'm looking at their collections and they're terrible.
Right. That is so true. There's so many times where, and no fault to people who we didn't have great training in dental practices in the past. We didn't have great financial policies in place. We tended in the dental industry to say, oh, we're going to submit this to your insurance and we'll send you a bill afterwards, which really is not the way to do business. We want to make sure that we are, clear with our expectations, that we've got clear estimates that are correct, that we have the processes in place. But when we look at the practice and we see that they've got an over 90-day balance for patients, I've seen it up to $350,000. And we're not policies in place, nor somebody really watching that it got that out of control. And then that's stale money. That's money that people have been owing for quite a long time. And the longer it sits there, the more difficult it is to collect. So then we tend to see write-offs. And the reality is, if this is a multiple provider practice, which it was, so they had, I think it was 5 different dentists in that practice. The owner dentists were, of course, getting owner draws on there, but the associates who were just showing up, we're getting paid their 30% of their production, whether or not it was collected. And so then you have to look at, okay, do we want to quantify that we are paying our associates based on the collections that we've received of their production, not just based on what they produce in a month? So there's just so many different areas that we have to really be clear, and then have clear systems in place to ensure that we've got a constant influx of the collections.
You know, it's interesting because I was reading a recent article in Dental Economics, and their position was, strong production demonstrates a healthy patient flow and a demand for services, which, I mean, that to me is common sense. It indicates that patients are seeking treatment and the practice is actively providing care. But where where do you find maybe the disconnect there is what you see as far as all of your services. You know, it reminds me of real estate. What you see is all of your services. um, you know, Production to me is a potential for revenue. And the reason I mentioned real estate, my brother's a realtor, and he says, people are so listing happy. They just want to put listings up, but how many sales do you have? And it
Right.
seems to be there's a parallel there that yes, production is important, but it's potential revenue, right?
Right. And there's so many different levers that we can affect in a practice to drive the bottom line. And to me, the bottom line is the collections. That's how I show my ROI, is do they have an improvement in their collections? Which means inherently we have to increase our productions. And people get really uncomfortable when we talk about production numbers and goals in dentistry, because they got into the industry to feel good that I'm helping people, which is true. And I want to challenge people to think about, so in dentistry, on average, 1 in 3 patients say yes to their treatment. So I want to know that the doctors that I'm working with are diagnosing the best care first, meaning the absolute best solution to their problem, not thinking about money, not thinking about anything else other than, hey, if this patient were my spouse, if this patient were my child, what treatment would I recommend? And that's what that patient deserves to know first. Now, whether they can afford that treatment or not is another conversation. But I want to know that we're diagnosing best care first, and then we're working hand in hand with that patient to find out, is that a viable solution for them? So there's no judgment. If they can't afford the implant and they want to go ahead and do the bridge, that's absolutely fine. If they can't afford the bridge and they want to do the partial, then that's absolutely fine. But I want them to know why the implant is the best long-term solution and why each other solution is less of a long-term solution, right? And I want them to have that mindset that they're making the decision based on where they are in their life. It's not based solely on money or perception. So we don't want to diagnose their wallet ever. So that's number one. And then we look at, what do we need to produce as a practice and as a whole practice? What do we need to produce so that we can collect 98% of that? Because that's my target for my practices, is to collect 98% of their production. Granted, that's net production, right? Like if we're in an insurance relationship, I can't expect them to collect the amount that we're writing off. So we want to know, big picture wise for the entire practice, what's that big number? And then break that down by each provider. And so let's say that I've got a provider and they've been in dentistry for 7 years and they're fairly good at diagnosis and case acceptance. And case acceptance, I'm looking for 33%, 1 in 3 patients. Which means we're leaving that 67% of patients that are not moving forward. So we should always have treatment already diagnosed to convert. But we look at that, and if that doctor wants to produce $100,000 a month, they have to be diagnosing $300,000 a month to easily hit that goal. So we want to look at all these different metrics to know what's our starting point, what's our goal, where's our gap, where's those opportunities to increase either case acceptance, or we're going to increase the diagnosis. Like you can pull on one of those levers to affect the change. And once we get that doctor out of their mind, out of feeling bad that I have to diagnose dentistry, which in all honesty, a lot of dentists feel. And the great news is they're great providers. They went to school. They have a kind heart. They want to help people. But they shoot themselves in the foot when they tell the patient, you need this treatment, and you can go ahead and get scheduled anytime you want, which tells the patient, gosh, I don't need to do this until it breaks or it hurts. So there's so many layers and so many ways to affect what we're reaching for. But bottom line, we have to grow the practice. And if we look at, I see on Facebook posts, how do you increase revenue immediately in a dental practice? And people automatically go, oh, we've got to reduce overhead. Yeah, you can reduce overhead, but when fixed costs are what they are, when lab costs are what they are, you really can't affect that. The only way you can affect that is by increasing your production. And if you can't increase your production because you're not diagnosing more, then we need to have a conversation. But we tend to not always talk about all of the causes of why patients need dentistry. So we tend to address cavities a lot. We tend to address occlusion some of the time, not always. We want to make sure that we're addressing perio to the extent that it is. They've proven that periodontal disease is causal for heart attacks and strokes, as well as Alzheimer's. So we really have some due diligence to apply to help our patients be healthy and have different conversations, that we're not selling dentistry. We are helping our patients be healthy and successful in life. And when we look at those risk factors, are they talking about those for every patient? Are they offering to every patient, the cosmetic options? Have you thought about whitening your teeth, or even just asking your patient, gosh, where would you rank your smile on a 1 to 10? And if it's a 7, what would you like to see differently to get you to a 10? So it's conversations, it's communication, it's confidence. It's walking into that room and, do I have your permission to tell you everything that I see to get you to a 100% healthy mouth, like I would do if it were me or if you were my spouse? And when we have that permission and we have that confidence, and we treatment plan based on best care first, and then we have to help the patient understand what's the cost. We've got to give them a range for the cost for this product, and give them a ballpark. So, you're probably aware that you've got quite a bit of damage in your mouth. It's been 5 to 10 years since you were last in. It took you a while to get to this point, and we can work at a pace that works for you. It can take 6 months. It can take 6 years. We are here to walk this path with you. But if I look at everything in your mouth, I see approximately $30,000 worth of damages. When we give them that ballpark, they can process that, and then we can work on, how do we move forward? Is it going to be an arch? Are we going to do the top arch and then the lower arch? Are we going to go quadrant by quadrant, or do they need to go tooth by tooth? There shouldn't be judgment. We want to communicate why it's better to do more teeth at one time. Like, we want to give them those options. If we do sedation, I want them to offer them sedation. But when we don't give them that ballpark and we send them to the front desk, they don't know where to start and they
Right.
freeze.
Well, one thing and you brought up a lot of information there, so let me unpack a little bit of this, because I think one thing, because I just did an evaluation of a dental practice, and it was interesting because, and actually on one of our NSCHBC podcasts, I actually did a soliloquy. It was a solo podcast because I think some people forget that there in dental, there's not just dental insurance, there's medical insurance options. And, when you're doing tooth extraction, some plans will pay for that as oral surgery. And if there's, infections versus abscesses, things like that, that doesn't fall under just routine dental. That falls under medical plan, insurance. And so now there's even more avenues for collections and revenue and things like that. And I think sometimes that's missed. But the one thing I wanted to bring to your attention is, and I see this not just with dental, but this is with all medical practices, and probably to the point where people are sick of me saying it, but it's like maybe at some point you'll hear me. I noticed that when a lot of dental practices start up or medical practices start up, and I want to say this with sensitivity, they tend to use family members in their, not just the front office, but in their
Mm.
financial department. And Callie, I can't tell you how many times I see things where I'm like, well, if you had a certified dental coder or a certified, professional coder if it's medical, or, a certified biller or, whatever, somebody who, or even just an experienced person in understanding the billing process, they would know the difference between dental and medical insurance. They would know when, this is routine versus not and coverages. But, robust collections, that's crucial to translate production into actual revenue and profit. And do you ever find that you just don't have the right staffing sometimes? I mean, take the provider out of it. You've got to have your support staff that understand what's going on from that point.
Absolutely. And I don't have the experience in the medical industry to say anything as a blanket conversation, but when I look back on dentistry, I came into dentistry, I was 24 years old. I had been a flight attendant. I had zero clinical experience and zero dental experience. And I was taught how to do the mechanics for collections. So I was trained on how they had been doing them, but there was absolutely no official training. There was no certification that I could go to. There were no groups like ADOM where I could get training from industry experts. It was sink or swim, and it really was follow pretty much the steps that they had told you. And unfortunately, it's that way in a lot of dental practices because they're small. They're not a corporation. They don't have the access to those trainings. But I think that now with technology and with so many podcasts like you are having, with the groups that we're seeing where we can get education, we need to take that leap. We can't stay back in the 80s where we did it the way that Susie taught us, and we don't even know why we're doing it that way. And so you hit on something like certified coding. There was nothing like that when I came into dentistry, and I think the first resource I really had that was phenomenal was Teresa Duncan was a speaker, and she was great to give us updates. And the other thing was the Charles Blair CDT code book that actually told you the legal ramifications of the codes and how to properly use those codes and when to use that code in conjunction with another code. And we had a doctor, he went to some training, started placing some implants, we were doing some sedation. Gosh, I didn't know that we were supposed to be doing the sedation one code for the first 15 minutes and another code for every subsequent 15 minutes. And those are the things that the practice is probably doing, but they're probably losing out on that production because they have not been properly trained. So I love that this group is a melding of medical and dental because I think medical has a lot of these things, these systems really well oiled and ready to go. And I think that we can assimilate the dental into that and know that we're hitting more of those targets. We have procedures for them to get trained. And, COVID was a brutal time. We lost so many team members in the dental industry. And I think they've scrambled to fill those positions. And oftentimes they're hiring somebody up front for personality and not for experience. And they've never had standard operating procedures written down. They've never analyzed why or how they do what they do to see is it the most efficient or legal, or are we maximizing our capabilities? And that's where, I think that industry experts are amazing. And I think having an analysis done of your practice, so finding a consultant that specializes in the coding to look at what you're billing, what are your procedures that you're doing? Are we missing? Are we missing things that we should be billing? How do they learn to differentiate between a medical billing for an extraction versus the dental billing? And I think that if you look at the long-term success of your practice, if you're doing a lot of those procedures, it would behoove you to hire a consultant, do the analysis, and make sure that you're doing it the way that you should so that you're maximizing all those procedures that you're doing.
I agree, because a practice with excellent production but weak collections will struggle financially.
Oh,
And
absolutely.
and so both production and collections are critical for a practice's financial well-being, but production lays the groundwork by creating the services for which payments are collected, making it the foundational element for practice success. But I'm with you. Collections would be your bottom line, and without them and without knowing how to collect them appropriately, having the right people in to do the collecting for you and know how to trail it, I think could wane in that success of that practice. So, final thoughts on this as we close today?
I encourage people to think outside the box. I think if you're kind of in a situation where you just don't have an established team member that's capable to do that, there are amazing people who specialize in the billing, who are at, they know how to code correctly. They know how to submit the claims cleanly the first time, and they can take your whole revenue cycle management and you can have somebody that specializes in it at really not that much of a cost when you think of the return on your investment of what they're adding to your practice. I love having team members that are great with patients, and that increases our trust with the patients, which increases our case acceptance, which then leads to more production. So it doesn't matter how you slice it. We really need to be intentional with our practice and our team, education, services, systems, support, and know that there are a lot of resources out there, and take a look and join a group like this group that really gives you some amazing feedback and people that can help you be successful.
That is awesome. Well, we'd like to thank Callie for being on our podcast today. We appreciate her insights into this important topic in the business of medicine and in dental medicine. And so, Callie, thanks for being here.
Appreciate it. Thank you so much. It was a great time.
You can find the contact information for Callie Ward at nschbc.org under the Find the Consultant tab. Type in Callie's name, Callie, her first name, and there she is. As a reminder, the nschbc.org website offers monthly free webinars like this that coincide with our podcasts on a variety of topics, as well as quarterly Medicare updates. For all educational offerings, go to the nschbc.org and click Upcoming Education tab. That's it for me today. Please join me next month as we once again bring you current and important topics in the business of medicine. Everyone, make it a great day, a great rest of your month, and thank you for listening to the NSCHBC Edge podcast. I'm your host, Terry Fletcher.
Thank you for listening to the NSCHBC Edge podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.